And Daniel, one of the things that always comes to mind for me is that you need these relationships, you need to have them before they're needed, right? You don't want to have to go into a representative's office, a state representative's office, at the moment you need to make a case. You want to have a relationship built beforehand, built on trust and shared values.
Yeah, good engagement really is about building a relationship. And a lot of advocates approach their work as advocacy and as outreach. And there's an old saying that outreach presupposes an outcome and engagement arrives at one. And that's part of that discussion. That's part of that relationship building that really does take some thoughtful approaches. It takes skill. It takes personalizing it so that it matters to it apparently matters to you and therefore will matter to lawmakers or their staff or other stakeholders who have an important role in improving their communities as well. Science can play a role, and scientists themselves should play an increasingly visible role with elected leaders, but also with unelected leaders. There are many, many civic, business, and community leaders who can benefit from the information and the perspectives our scientists can bring them. This is a job that we can fill, and it's a role that needs to be filled.
Yeah, and there's something about the genuineness and the credibility that comes from being of the community. That it's not gonna come from me flying in.
Right.
Yeah.
Yeah, that's true. And another aphorism I want to offer is that practice doesn't make perfect. Practice makes better. And that's part of what AAAS has done through our training programs for years is provide training and workshops and guidance for our science members to learn how to do this work, how to communicate, how to do good engagement, and how to do effective advocacy. So this program hopefully will continue to deliver that, but allow us to apply it in a whole new range of opportunities for our science members.
That's great, Dan. Well, it certainly fits into our mission of advancing the science. We want to see physics and material science and biology all advancing and serving society, and that just fits in so perfectly. Dan, one quick question. How do people get involved with Lscn?
Well, we have a new site on AAAS.org. If you go to the program page, the Local Science Engagement Network has a new page there. There is a join button. That will take you to our public engagement platform where you can sign on. Once you put in your address, it will show you your elected leaders from federal all the way down to state, county, and local. And as we build campaigns, we'll design them to reach out to those leaders when appropriate. We'll also start posting resources there so we can begin training and guiding people as they develop their interests and skills. And we also have a member community page. A lot of AAAS members have enjoyed member community. Lscn is a great place. Our member community is a great place to chat with other science leaders, pose questions, share insights, and help figure this out. This is, something that we'll do together as a network and get stronger by working together and sharing ideas.
That's great, Dan. Well, look, I know I gotta let you go so you can get to your session, but this is a terrific program. I look forward to seeing it grow to beyond the 4 states into 50. Thank you.
We're on the way. Thank you.
All right. All right, and now I'm going to turn it over to Olga to go over our sessions.
Thanks, Sudha. For those enrolled for the scientific sessions, here's what we have on tap for you. We have the following sessions beginning at 3 p.m. Eastern: Computing Artificial Intelligence as Social Impacts and Inflection Point, Evaluation and Promotion and Protection of the U.S. Bioeconomy, Interdependence of Health, Livelihoods, and Aquatic Social Ecological Systems, Rethinking COVID-19 Surveillance at National, Regional, and Local Scales. The COVID-19 pandemic has revealed both a compelling need for coordinated and timely surveillance and painful and costly gaps in national, regional, and local data collection efforts. This session will contrast the needs of public health surveillance with traditional and novel data collection, as well as synthesis efforts aimed to provide timely and actionable insights. The next, Strengthening Communities and Scientific Research and Adapting to Climate Change, The Dynamic Past, How Science Helps Give Voice to Silent Stories, and They and We Are What We Eat, Linking Diet and Gut Microbiome to Human Health. Also at 3 p.m. Eastern are 2 exchange events from AAAS, Back to Basics, Eat Like Our Ancestors, and from ASU, Rational Design of Fluorescent Biosensors Uses Non-Canonical amino acids. At 3 p.m. Eastern, we have a great selection of workshops that are open to all registrants. From Culture, Equity, and Inclusion track, movement building in STEM in the midst of Black Lives Matter movement, from the advocacy track, creating science policy, capacities and opportunities through fellowship programs, science communication as a tool for training the next generation of influencers, and scientists as citizens' pathways for local government engagement. And from the career development track, engaging with institutions abroad through the Fulbright Specialist Program. And You Are a Leader. Navigate your STEM career journey through 360-degree leadership. Such great stuff. That's our menu for now, Sudip.
Wow, I gotta say thank you. I gave Olga about a minute and a half to do all that, and she read every bit of it. So thank you so much, Olga. That does it for us right now. Go and enjoy the next block of sessions, and we'll see you back here at the next hour.
Hello, my name is Meredith Drostback, and I'm the Associate Director for Science at Sciline, the program at AAAS that connects scientists with journalists looking for expertise and context for their stories about science, health, and the environment. For over 3 years now, Sciline has offered a variety of free services to reporters from newsrooms large and small across the United States. All of them dependent on the generosity of scientists across the country willing to share their insights with the media. Whether it's finding the right source for a specific story on deadline, hosting a media briefing with a panel of experts to educate reporters on a timely science topic, or publishing written quotes from scientists on the day's breaking news, we at Sciline aim to bridge the divide between journalism and science, especially for reporters without a science background or who don't often have the opportunity to cover science in the news, and help bring relevant and timely scientific evidence to the public. Over the last year, we've worked with journalists covering some of the biggest science stories of our time, from the COVID-19 pandemic to the ongoing climate crisis, to the public health and social impacts of racial injustice. What you'll see in the video clips that follow are brief segments from just a few of the media briefings we hosted in 2020 related to COVID-19. These briefings featured scientists like many of you attending this year's meeting, scientists willing to share their expertise and answer questions from the dozens to hundreds of reporters who log into each of our briefings. We at Sciline are grateful to all of the scientific experts who have so generously taken the time to provide reporters the research findings and evidence they need to keep their communities informed about the issues that matter most. For more information about Sciline and how you can get involved, check us out at sciline.org. And without further ado, here's some of our highlights over the past year.
Yes, adolescence is that strange time of life. There's a great book. The title says it all. Leave me alone, but first, can you take me and Cheryl to the mall? It's really where adolescents are trying to develop their own sense of self, and they still may need their parents and caregivers, but I have a harder time telling you I truly do. I think that's why it's so important to ask the question, tell me what your friends are saying. Because if their friends are all saying, gosh, this social distancing thing, I don't really believe it, we're doing fine, then you know where you can start in terms of that misinformation and misperceptions about risk. I think it is important to talk to teens and to acknowledge it is not fun to stay inside. It is not fun not to be able to hang with your friends. All of those things are things I wish we could do again, and I wish you would be able to do. So validating and acknowledging the distress and sometimes the anger and the sadness that comes with that. Think about how you can connect. Can you have a group call with friends? Can you play a video game with friends? Are there other ways that you can connect with friends and plan that each day? I think it will help with school learning going online, because you'll at least be able to see that my friends are still out there. But can you think of other ways that they can connect and ask them, how would you like to do it? I think it's also really important to recognize and to help our teens understand the reason you're having to do this, even if you are at low risk for having serious problems, is while you may not have it, you may bring it home to somebody you care about. Or you may not know that a friend has an underlying health condition and you may inadvertently make them very ill. So really asking the question, who are you doing this for? How can you be proactive about doing something for someone else? So as they move forward, we've seen this, for example, after school shootings. Can you make some meaning out of something that is very difficult for you and helping them to do so? That's where we have to recognize that what's the new hashtag, alone together? So for that individual, if you know that there's an individual living alone, think about, are there ways that you can connect? Whether it's when you're baking, that you ring the doorbell and leave them some baked goods. Whether it is when you take a walk each day, make sure you wave. Are there things too if when you go to the grocery store, can you help that individual by bringing something back? I think finding ways to have that connection is important, but also, is there something that individual may be able to do as well? So it's not everybody's doing something for someone that lives alone, that we stay connected, but also, is there something that individual feels that they're providing in the community too? I know the other day in my cul-de-sac, there were 3 neighbors outside, all about 12 feet apart, sharing information about the latest kids game in the neighborhood in terms of walking through the neighborhood and spying bears in windows. So it may be that individual that lives alone can participate in that activity in their neighborhood by placing a bear or another stuffed animal for other children to see. So again, I think it is very true that individual is certainly more at risk because there's not a physical presence of someone else, but how do we help keep them connected? And what are 1 or 2 things that they put in their schedule every single day to connect with someone else in some way, shape, or form? It needs to be part of their daily routine.
We are severely, as most folks on this call have said, undercounting, just from a general public health standpoint, right? And so we are primarily at this point doing diagnostic testing within the context of healthcare systems. And we know that COVID-19, folks can have the virus and be asymptomatic for weeks, right? And so the fact that we're not doing widespread surveillance, first, is a public health issue for all of us. But for those who are most vulnerable to this disease, communities of color, homeless folks in prisons, the fact that we're not doing the kind of widespread surveillance to know where the disease exists is really contributing to the disproportionate transmission, exposure, transmission, and death among communities of color. And so I know, for example, in Philadelphia, there was a group of Black doctors who have worked to massively increase, or to the extent that they can, increase testing over the last couple of weeks. And they're finding rates of COVID-19 that are being missed by our current practices, right? So we know, again, that this is happening. There's data early on that I mentioned earlier that showed this, that there's less testing in Black communities and poor communities, despite having higher numbers of cases. And we know it's a structural problem. These communities didn't get access to testing. Federally qualified health centers were not given those things. And we know that those centers are the centers that, serve poor and minority communities. So again, testing is absolutely one critical point that is making the pandemic worse in communities of color. I think that's actually a really, really important point. And I didn't get to this in the talk that I gave, but a couple of things on the migrant populations. One, just like other marginalized racial groups, there's probably severe undercounting. But migrant populations, both documented and undocumented, also have this history of surveillance in their communities that make them distrust even the healthcare system. So they may not be accessing healthcare systems, et cetera. So I think that's really important to note that, we're seeing these rates among Blacks, but, we might be really missing, and migrant communities, undocumented communities, and the like might be severely undercounted and be rendered visible during this pandemic. In detention centers specifically, I don't think they're releasing data. A team of us were trying to look for data specifically on detention centers. I have a colleague at the University of Miami who's been looking into this because of her work in incarceration. And the data is not being released on COVID-19 within these populations. And again, I think this is really rendering this population invisible. But again, just like prisons, and I think Dr. Bree Williams can speak to this, they have overcrowded conditions, unsanitary conditions that would make the pandemic, really wreak havoc in these settings. So again, I think we're really just, among all of these groups, severely undercounting, really don't know the extent to which this pandemic is playing out there. And this is really tragic that this is happening.
That's a really great question. It's multifaceted, and I'll say a couple things because I could take the whole time responding to this. First is, the conditions of confinement in prisons have been a problem pre-COVID. People who have been doing research in these areas, like me and others, have already been ringing alarm bells around the fact that population groups in prison are not getting the services that they need, whether those are health or other kinds of requirements to live a healthy life, like access to healthy foods, proper ventilation, proper materials to be able to sanitize correctly. And you've probably seen news reports about this. So I think many people who've been studying this were just sort of holding their breath when the COVID pandemic hit. There are, I think, pockets of individuals talking about this across states, a lot of advocacy groups that are trying to collect better information. And to be sure, the services that were coming into prisons are important and crucial, especially given the lack of services writ large in most prisons and jails in terms of being able to accommodate things that the actual prison or jail can service. I myself work through the prison education program at Washington University. And of course, because of regulations, people can't come in. So I think this is an important issue that needs more attention, that's being talked about. And there are definitely funders across different states, et cetera, that are trying to work with researchers and advocacy groups to sort of help with that. And also to mention, as it relates to my presentation, is that a lot of the consequences of these experiences also impact the health of family members and communities that individuals in jails and prison are connected to. They're the ones paying the commissary and already have strapped for cash, are then having to send that money to family members. They're the ones worrying and having to call and use time to figure out what's going on. And in some states there have been early release of individuals, but because there has already been infection, that means individuals are returning to communities that may not also have the capacity to deal with being able to, for example, properly quarantine. So it's a multifaceted issue that's not just a criminal justice policy issue. It extends to so many dimensions of our sector. And so I think that's a really great question. I don't know if I answered it, but those are just some of the things that popped in my head. For almost all of our research, one of the things that is sort of a punchline for people who do work in this area is that even if we were to equalize healthcare access, we're still going to see disparities, and we can talk more about what that means. But I think, access to a vaccine, of course, is key, but we also have to be addressing other conditions that impact the health and well-being of individuals and put them at risk for COVID-19 infection in the first place. are people overrepresented in essential jobs, racial residential segregation, housing quality, et cetera. They're all intermixed. And so thinking just about the vaccine in a very narrow way is going to be problematic because you're still going to see disparities. And I also think it's going to be important to frame this when we do talk about the COVID vaccine, as Chandra alluded to. I think there needs to be real discussions about around access, because I think oftentimes the narrative in the media can turn to individual behaviors and perceptions when we're really not thinking through access issues. Clearly, access issues are impacting communities now. Access to PPE in, for example, reservations, et cetera. These are crucial issues now, even before we've gotten to the immunization. So I think we can use what's happening now to help us to kind of foresee what can happen in the future and hopefully intervene so those things aren't happening. But again, I want to talk about the vaccine, but we need to be thinking more systematically, system-wide, or we're gonna end up in similar situations where, again, we're gonna see disparities.
Not all of the vaccines are going to require 2 doses, but if you're getting a vaccine that does require 2 doses, that's because you need that second dose, you need that boost in order to mount the level of immune response that the vaccine can provide. And that second dose really does make a difference. So we really want to make sure that as these vaccines are distributed, that they are distributed to people in a way that enables the ongoing medical care, the appropriate second dose, and the ability to track in terms of if there are safety issues or to learn more about efficacy.
Hello, my name is Meredith Drostback, and I'm the Associate Director for Science at Sciline, the program at AAAS that connects scientists with journalists looking for expertise and context for their stories about science, health, and the environment.